Good morning, everyone. Welcome to another Wednesday Wellness webinar. For today's topic, we have chronic bronchitis, which is also a type of COPD or chronic obstructive pulmonary disease, which was discussed last week. I am Mary Codine Casabuena, your speaker for today. For today's discussion outline, we have the overview of chronic bronchitis. We also have the symptoms, causes, risk factors, diagnosis, treatment, and how to prevent it. Chronic bronchitis, it is a long-term inflammation of the bronchi. When we say bronchi, ito yung air tubes in the lungs or the main passageway into the lungs. It is also common among smokers, and people with chronic bronchitis tend to get lung infections more easily. So we have pictures of what we call the bronchi. So the other one on the left side is a normal bronchi, and on the right side is chronic bronchitis, or ito yung tinatawag natin na bronchi which has chronic bronchitis. So there are two different pictures. Sa chronic bronchitis, nagkakaroon ng inflammation of the airway. Then nagkakaroon ng increased mucus glands or nagkakaroon ng secretion of mucus, and then nagkakaroon din ng muscle hypertrophy. When you say muscle hypertrophy, it is the enlargement of the tissues. So what are the symptoms of this? Since if the patient has chronic bronchitis, it means that the airways are filled with thick mucus. So often, nagkakaroon sila ng cough. Yung cough nila is hindi lang siya madalian, kundi it is already long-term. They also have that wheezing sound like for the asthma patients. And then they also have that chest tightness. And because of too much mucus secretions, nagkakaroon sila ng shortness of breath, and due to prolonged coughing, patients feel tired. So what are the causes of this? Number one is smoking. So, for those who are secondhand smokers, yun din ang another cause. Also, for those who are working din sa mga factories or nagpipaint ng bahay, it is also another cause. And those who are exposed to fumes and hairspray. Also, air pollution is contributory factor. Coal or fire smoke. So, what are the risk factors of this? As we all say, it is also smoking ang number one cause ng chronic bronchitis. And then the other one is age. So usually, since long-term siya, it always starts at the age 40. Exposure to irritants like dust, smoke, air pollutions. Then we also have genetics. Smokers who get chronic bronchitis are more likely to have, if they have a family history of COPD. So what are the diagnoses of this? The most common is the chest x-ray. For the CT scan, ginagamit ito to check a detailed look of the airways. And for the lung function test, we have a spirometry. In this kind of test, ginagamit ito to check the lung function of the patient. So the more patient blow ng air and then yung balls sa taas will stay. So it means to say that the lung function test of the patient is good. Pero pag the patient will just blow and the balls will just stay here or will not stay long, it means to say na may problem ang lungs ng patient. So what are the treatments of this? So we have the bronchodilators. Bronchodilators are used to make breathing easier. So nagre-relax din siya ng muscle sa lungs and nag-widen ng airway. So since nagkakaroon ng inflammation, that's why inflammatory drugs is being used. Also oxygen. So it delivers the gas for proper breathing and increases also the amount of oxygen sa lungs ng isang patient and para ma-deliver ito sa lungs. So how to prevent it? We have to avoid the situations where you are exposed to secondhand smoke. Reduce the use of aerosol sprays like deodorants, hairsprays, since the chemicals in this can irritate your airway. You have also to wear a mask when working in areas that are dusty or have strong fumes, and be sure to find a mask that is specific for the type of work that you are doing. So, mas makapal yung mask, much better siya for your protection. So that ends my presentation. Thank you for your time listening. Stay safe and have a great day. Bye!